what exactly is an Ogee BBL? Well, Ogee is just a architectural term. It's used in gardening, it's used in construction, it occurs in nature. It's really pretty simple. It's two lines. One is concave and one is convex. And it's really how I picture in my mind every BBL that I do or every lipo that I do. I'm always trying to create this Ogee line. It's different for every person. Here's an example of a patient. She's a couple months out from having a BBL. You know, I think a lot of times in a BBL, people will focus on the butt and the volume and the projection. Obviously, we have to have that. That's what a BBL is all about. But to me, it's a little bit more. And when I look at a patient on the operating room table or preoperatively, what I'm always looking at is how can I create the very best Ogee line for this patient? Because everybody's different. People are taller, people are thinner. You know, a myriad of reasons why the Ogee is different for every single person. Everyone is, you know, a snowflake. The Ogee line always starts up very high in the back. I think, you know, sometimes you see one incision here for the lipo and you don't get all the lipo through this area. You have to get the lipo through this area to get the Ogee, because the Ogee starts high in the back. All of this here gets lipoed. Everyone has different size waists. I mean, she's got a very small waist. She's a little bit straighter through here. Everyone is different. And then this is really where the rounding starts. This is the key area. It's a key area because it's key, it's vital, it's super important to start this rounding. You really can't get this round shape without lipoing in this area. And so for me, this is vitally important. I think if this is not lipoed, you end up getting squareness here. Now you start getting this. This is the concave line. That is the concave line. And then it starts to transition to the convex line. And so this line for me, I start here building out the hip. It comes all the way down. I try and get that line all the way out as much as the hip will allow me to go. And so some people have a more exaggerated convex line here. Some people have a little flatter convex line. It differs from patient to patient. But I always say that this operation is so powerful because it basically starts from the knee all the way up. But I'm not looking at this part. I'm looking at this outside line. If you just trace this line with your eye against the blue background, what you're going to see, that line comes up. You have a nice convex line, and then that concavity here that goes all the way up to the back. That is the Ogee line. There is another Ogee line. There's multiple Ogee lines really in the body. Look at this concave line here, and now that's transitioning into the convex line. So it's just a technique that I do to be able to get the prettiest, most natural shape. Volume is important to the butt. Obviously, she wanted to have volume, but I think at the end of the day, what's most pretty is a Ogee line and having that. And that's the most important thing, is to get a nice, pretty result, to get the shape that we want.